Hi guys, how are you? Good evening. My name is Mr. Alan Matus again, and we're here for our Facebook Live virtual coaching call, and it's going to be April 2, 2020. Okay, so for tonight, we'll be discussing some NCLEX updates, and also we'll be discussing a little bit of a few questions. So we will have prioritization questions again, and also delegation questions. So the focus of the questions will be on gastrointestinal system, and we only have a couple of questions for tonight. So participate and also try to answer some of the questions. Okay. All right. So the first thing that we're going to do tonight is to discuss first the NCLEX updates. So for the NCLEX updates, what's the hot topic in the NCLEX? For tonight, our hot topic is going to be the COVID or the coronavirus. I know that across the nation and throughout the world right now, we have this one big problem, which is the outbreak of the COVID-19. So remember that the NCLEX or NCSPN or the National Council for State Board of Nursing has made an announcement. It's making an adjustment on the how the exam will be administered at this time in adjustment or in response to the COVID-19 outbreak. So you can also find this information in the NCS website. All right. So the COVID-19 impact to NCLEX candidate. What is the change associated with this outbreak? So after making a number of changes to enhance the safety of those taking the tests, as well as the staff working in the centers, test delivery at US and Canada-based Pearson VUE test centers, the NCLEX test administrator resumes on March 25 at a limited number of test centers in major metropolitan areas across the United States and Canada. So the resumption is March 25, but they have made changes to how this examination will be administered. Okay, so let's look at the next slide of what will be the changes to this COVID, to the NCLEX in relation to the COVID-19. So first we have, of course, the response of NCSBN is to ensure social distancing measures are in effect, as well as increase the number of candidates that can test daily. The NCLEX-RN and NCLEX-PN effective March 25, 2020 until July 2020 will be administered as follows. So here you go. These are the changes. And as what I have said, you can also find these changes in the website. All right. So the update number one is that the computerized adaptive testing or the CAT will still be used for all examinees. So meaning that you will still be taking the examination using the computer. Okay, the computerized adaptive testing. However, there's a change in the minimum number of test items. So normally you have 75 or 85. So 75 for NCLEX RN and 85 for NCLEX-PN. But now the change is going to be that the minimum number of test items is going to be 60 only. So you'll be taking only 60 item questions. That's going to be the minimum. And the maximum will be 130. And this applies both to NCLEX-PN and also the NCLEX-RN. As you know, the NCSPN or the NCLEX is trying to make sure that we have a shortage and we really need nurses or healthcare workers. So as much as possible, they have to continue offering their service, making sure that new nurses or graduates are able to take the examination and practice in the field. The maximum testing time will be 4 hours. So this is lesser than the 6 hours or that we usually take for the NCLEX. Is going to be only 4 hours now. However, there's one thing that you need to remember: the difficulty level and the passing standard is still going to be the same. So there is no change in the passing standard. It's still going to be the same, so there's no need to worry if it's going to become more difficult or if it's going to become easier. It's going to be the same passing standard. Okay, but of course, the good news is the fact that we can take the NCLEX examination, and I think that that is the most important thing because we don't want to prolong the the um, the nurses, the waiting of nurses in order to take the examination, especially that most of these nurses have studied and the information is fresh and they want to take the NCLEX right away. Okay. If you need more information, you can also see the frequently asked questions for NCLEX candidates in the website of the National Council for State Boards of Nursing. Now, one thing that you need to remember is going to be the next generation NCLEX special research. As what you know, that the NCSBN is conducting a research proposal to change the format of NCLEX in 2023. But at this time, because of the COVID-19, they are not going to include the research questions for next generation NCLEX in the computerized adaptive test. So that's the reason why the total number of items is going to be only 130, and at the same time you have 60, which is the minimum number of questions for the NCLEX. Okay, so that's it. Okay. Now, another one, we have one possible question that you may have in terms of these changes for the NCLEX. Of course, you'll be going to the testing examination. You'll be having some worry about the possibility of being infected with COVID. Okay. However, the NCSBN, or let's say the Pearson View, is undertaking steps to make sure that you are protected when you go to the testing sites. Okay. One question will be, will candidates be allowed to wear any PPE during the exam? So what is the response of the NCLEX to this concern of candidates? Of course, the answer to this is yes, you are allowed to wear medical face masks and gloves. Okay. They are considered to be as external link comfort aid and do not require pre-approval. So you can actually go there and wear your PPE. Rest assured that Pearson View is thoroughly cleaning and disinfecting their open test centers, including all objects that candidates interact with, including scanners, keyboards, and locker fobs with increased frequency and certainly between each test taker. So, as a piece of advice, of course, when you go there and then you take your NCLEX, make sure that you observe proper precautions to make sure that you don't get infected with COVID, or as much as possible, we have to protect each other. And the most important thing is that you're able to take the NCLEX, okay, safely, and hopefully you will pass the NCLEX as well and start practicing because we really need healthcare workers right now because of the outbreak of COVID. Okay. All right. So we are done a little bit with update about the changes of the NCLEX administration in terms of the COVID outbreak. Okay. So let me find out if there's any other persons now in the comment section. So we do have some people available. Okay. So we have Kathy. We have Maru, who is my previous student before. Hi, Maru. Can you please say hi? If you can see in the comment section, you have there a link. If you want to show your face when you comment, then you click the link and allow that your face will show. But remember that this broadcast may be posted in YouTube. Okay. All right. So let's. Okay. So we have hello. Okay. Yes. So we have a hello from one of our users, and that's I guess Maru. Okay, so for tonight, I prepared simple questions only for prioritization and delegation. And the reason why our Facebook Live virtual call is always focused on delegation and prioritization, it is because that a big chunk of your NCLEX examination will be focusing on delegation and prioritization. So we'll be having the first question. Okay. Everybody feel free to comment anytime. And as what I have said, there is a link there that you can click to allow yourself to show on the broadcast. And this will be shared with YouTube, of course, if in case. And of course, feel free to answer questions. Okay. So the first question that we will have, so is going to be something about prioritization. So let's go to question number one. Okay. All right. So this is a question that focuses on prioritization. All right. So let's have the question. Okay. All right. So the question again is the nurse is caring for clients in the medical surgical unit. Okay. So we have one person who said, four, LSM, the reunion. Okay. Hi, how are you? So you answered number four. Okay. So let's have another one. So we have four as well. Okay. So let's see what's the other answers of the other people. Okay. So the answer to this question, let's see what's going to be the answer. So, okay, so a lot of four. So we have one person also saying here, four, four, four. Okay, let's see. So again, the nurse is caring for a client. So which one takes priority first? So number one, is it perform wound care of a client who came from a group activity? Two, explain to the UAP how to change the Foley bag of a patient? Or three, contact the case manager of a boarding care facility? Or number four is going to be assess a client. Can you put your rationale why you answered number four? Because number four is the correct answer, everyone. Okay, so always remember number four indicates a patient who is unstable. So we need to see that patient first because that patient is complaining of thirst and water stool. And remember that we have to base our answers on airway, breathing, and circulation. But remember also that letter D is a patient who may be having dehydration later on and fluids and electrolyte imbalances. So we want to find out first if the patient is okay. All right. So the simplest answer for this is number four. Very good. So let's see how many people got the right answer. Very good. Okay. So congratulations, Elisim. Okay, you got the right answer for this. Let's go to number two. Okay, number two question. All right. So this is the next question. So after an end of shift handoff report in a surgical floor, which client should the nurse assess first? One, a client who is 6 hours post-op with fever and board-like abdomen. Two, a 6 hour post-appendectomy client complaining of surgical pain of 7 to 10 scale. Three, a client who underwent gastric resection with hypoactive bowel sounds. Or number four, a client scheduled for discharge who complains about not understanding his medications. So which patient will you be assessing first? So remember that in the NCLEX, okay, most of the questions that you will be receiving will be analysis and application questions. And most of the common types of analysis and application question, especially application, will be something that is about intervention and prioritization. So that's why you really need to master the principles of delegation and prioritization. So again, going back to prioritization, always prioritize those patients who are unstable. And those unstable patients could be patients who have airway issues, breathing, and also circulation issues as well. Unstable patients could be those patients who just came from surgery, patients who just recently admitted. Those are unstable patients. And there are some conditions wherein the patient is really unstable, and that would be no matter what the situation is, it's an unstable patient. So, for example, chest pain, hypoglycemia, for example, those are situations wherein it's really an emergency. Okay. So what are the other examples of unstable patients? As what I have said, newly admitted. If the patient is about to be discharged, that patient is most likely stable already. Okay. A patient who just underwent a procedure is unstable, and you always have to look at the clinical description. The clinical description is the phrase that describes the situation, and that will help you prioritize. So even if the person, for example, has myocardial infarction, but if the clinical description is that this patient had myocardial infarction for a month already, more likely that person is already stable. Okay, so be careful with clinical description because it changes the ball game when you answer prioritization question. Okay, and always remember in the NCLEX that any life-threatening situation or condition will not be mentioned. Most of the time in the NCLEX, you'll be given signs and symptoms of life-threatening conditions. And that's why it's important for you to know the different life-threatening conditions and what are their symptoms or signs and symptoms, because in the NCLEX, they will not tell you what condition the patient has, but they will tell you what's going on by giving you the assessment or by giving you the labs as well. Okay, so for this question, what's going to be the answer for this question? Okay, so let's see. Client, okay, so some of you answered. Okay, so Rowella, you answered. Okay, hi Rowella, how are you? Okay, it's nice to see you. You were in my class also last Tuesday. All right, so we also have Myra, you're already here, so we see you as well. Okay, so thank you for coming over. So what's the answer? Is it number one? So most of you answered number one for this question. So let's see. So which one will you assess first? Is it number one? Okay, so number two. Can you put your rationale why you answered number one? Can someone tell me why is it number one, which is the answer? Of course, number two can wait. Number three is a little bit okay. So maybe you want to answer that, but remember that when the person had a gastric resection, it is expected to have hypoactive vowel sounds because of the effect of surgery. So number three is kind of like a little bit expected. Okay. If the person has hypoactive bowel sound and it's been like days after surgery, then you have to worry about that. Okay. Number four is not really someone that you may really want to see right away. And number two, okay, it's pain. So yeah, you want to see the person, but then of course the answer is going to be number one. So why is number one the answer in this situation? Can someone tell me what's going on when a person has fever and a board-like abdomen? Okay, so we know it's infection, but then what infection are we talking about? You know, what is this serious infection that we need to, we need to be aware of and make sure that we assess properly and do the intervention because it's life-threatening. Okay, so infection, very good, Kai. You said it's infection. That's correct. Okay. Okay, very good. Someone mentioned peritonitis. Okay, so who's this person? So peritonitis, very good. So board-like abdomen, peritonitis. So one tip that I will tell you in the NCLEX again is that you need to know all the examples of life-threatening conditions and you need to know their signs and symptoms. So with peritonitis, that's going to be the answer is going to be number one because peritonitis is characterized by board-like abdomen, painful, tender abdomen as well, and then also you also have fever. So we need to give antibiotics. We need to give IV fluids to this patient. So and also we need to do the compression as well. So possible peritonitis, yes, of course. Okay, so that would be the answer. Very good. Fever and board-like abdomen. You get the right answer for that one. So let's go now to the third question, everybody. Okay. All right. So this question is, of course, a gastrointestinal system question. So we have a barium swallow exam. So the nurse prepares a client with gastric ulcer disease for a barium swallow examination. Which nursing action is most important? One, assess the bowel sounds before the exam. Two, give the client NPO prior to the procedure. Three, tell the client that he will drink a whitish liquid. Or four, check for the presence of a gag reflex. Okay, so be careful when you're answering this question because sometimes one of the things that happens in the NCLEX is that you really have to answer what the question is asking. So I chose this question because one of the things that can happen when you're taking the NCLEX is that you just saw something that looks familiar and looks nice, then you will just choose it. No, you have to really answer what the question is asking. So before you look at the options, make sure that does that apply to the situation. Okay, this is a barium swallow exam. Assessing bowel sounds, is that important? Keeping the client NPO, does that apply? Drinking a whitish liquid, is that correct? The question here is most important. Okay, so show me your answer, everyone. Don't be scared. Okay, all right. So what do you think is the right answer in this situation? Okay, so gastric ulcer disease. So what is barium swallow anyway, everybody? Barium swallow means that you're going to swallow a whitish liquid, of course, a chalky substance, and then that will be that contrast medium is needed in order to do your X-ray. Okay, the X-ray. So you call it barium swallow. And we all know that barium also is constipating. We know that. That's the effect after the procedure. But before the procedure, what is your focus? Okay, and what's the most important? So before barium swallow, you need to make sure the client is NPO. You need to make sure that we cleanse the bowel of your patient, okay, to make sure that it's clean. If that is needed, if that is ordered by the doctor, if necessary, to give laxatives if needed. But this is only a barium swallow, okay? Especially cleansing of the colon really applies to barium enema, all right? Barium enema. But still, with barium swallow examination, the most important thing is keeping the client on NPO. Okay, so some of you answered number four, checking for the presence of the gag reflex. Number two, okay, NPO. Okay, so Kai said NPO. Alsim, NPO also. All right. So you can put your name when you answer so that we can identify who you are. Okay. Okay, so the correct answer for this one is going to be number two. Number two is the answer. Very good. So number two is the answer, and the reason for that, you're talking here of the most important. And of course, the most important is for the patient to be NPO because in barium swallow, you will be swallowing liquid. So the patient needs to be NPO before the examination. Okay, now checking the gag reflex, you may have been confused here a little bit because the gag reflex applies to bronchoscopy or esophagoscopy or gastroscopy when you're using a scope pass through the mouth of your patient, and that one is where you have to check the gag reflex. And this is what I'm saying, that when you're answering in the NCLEX, you have to make sure that you just don't check the gag reflex. You really have to go back to the situation and answer what the question is asking. Okay, so make sure, think first, what is barium swallow, what happens there. So the answer is going to be number two. All right, number three is correct, drinking a whitish substance, but then remember the question is the most important. So you may have different answers that are correct, but you have to choose the one that is most important. So again, going back in the NCLEX, be careful when you choose the options, okay? And always use the process of elimination, okay? And before you answer that option, you have to go back to the question again and ask yourself, is this something that really answers the question? So be careful, okay? You have to read the situation three times, and then when you pick the answer, you have to go back and ask yourself, does this apply to this barium swallow? And the first thing you really have to remember is know the content. What have you read about barium swallow? What are the things that you know about it? And then you will find out, oh yeah, why did I answer gag reflex wherein it is not the answer? Okay. So let's go now to another question. Okay. let's go to question number 4. Okay, so number 4 now. All right. So this is a question on delegation, everyone. So let's see what's your skill when it comes to delegation of nursing care. Which task should not be assigned to the UAP in the medical surgical nursing unit? One, performing shower of a client admitted for physical rehabilitation. Two, changing the bed linens of a client with diarrhea. Three, taking the blood pressure of a client with hypertension. Or number four, feeding a stroke client with dysphagia. So which one should not be assigned to the UAP? This question is a negative question. Okay, negative question means that you have three options that are correct, and then you have to find out which one is wrong because of the word which task should not be assigned to the UAP. So what do you think? You cannot assign to the UAP. Okay, can you assign shower? Can you assign changing bed linens, taking the blood pressure, or feeding a stroke with dysphagia? So which one should not be assigned? And when you answer, also please give your rationale. Okay, give your rationale for your answer. I would be glad to find out what's your reasoning behind the question. Okay, so let's look at some answers here. So Rowella, you answered number 4. Okay, so Rowella, number 4, very good. Okay, Elysim, number 4 also. Okay, can someone tell us the rationale? Okay, the rationale. So Mars, you answered number 4 as well. Very good. Okay. All right. So risk for aspiration. So that's the rationale. Okay, risk for aspiration. Okay. So for this question, of course, the answer is really very obvious. That's going to be number 4. Okay. So it has complication. Very good. Okay. So number 4 has complication. Remember that normally feeding the client is within the scope of practice of the UAP. But again, remember your golden rule when it comes to delegation. Any unstable patient cannot be assigned to a UAP. And one of the situations wherein the patient may be unstable is someone with dysphagia. If it only says they are feeding a client with multiple sclerosis, it doesn't tell you if it's an unstable patient, then the UAP can feed a client with multiple sclerosis. Okay, but then it says there specifically it is a client with dysphagia, so you don't want the UAP to be feeding that patient. All right. So congratulations. Also another one. RN need to assess the client with dysphagia. Very good. So that really comes first. You know, assessing the patient with dysphagia, making sure that it could be the RN feeding that patient just to make sure that there is no aspiration. Okay. So risk for aspiration, the others are within the UAP scope of practice. Very good. It is within the scope of practice. Very good. And at the same time, those patients, there's no indication that they are unstable patients. Okay. But number 4, your clinical description. I told you again, when determining an unstable patient, look at the clinical description. And the clinical description, the phrase is, it says with dysphagia. Okay, so that's really very important there. Very good. Okay, so now let's go to the last question, everyone. Okay, so our last question is going to be, again, another one is going to be on delegation. Okay, so which client can be assigned to a new graduate nurse? One, the client who is scheduled for colonoscopy in the afternoon. Two, the client who receives total parenteral nutrition for severe malnutrition. Three, the client who has recently underwent a cardiac catheterization. Or four, the client with Crohn's disease with fever and diarrhea. So who do you think, okay, can be assigned to a new graduate nurse? To a new graduate nurse. Okay, so are you going to assign a critical patient? Are you going to assign an unstable patient to a new graduate nurse? Always remember, if you are the RN in this situation and you are delegating, okay, remember, do not delegate EAT or EAT. Any patient that requires evaluation, assessment, and monitoring and teaching, you should not delegate. Okay, or any unstable patients. So let's have the answers. Okay, so okay. So we have Ruella is saying that one is a stable patient, okay, scheduled for colonoscopy. The others are not stable. So Ruella says one, okay. So Kathleen says also no one, okay. Let's see if that's the answer, okay. So stable patient also according to Ruella, okay. And then we have Mars. Mars is saying it's number one because the patient is more stable among the other cases. Very good. So this is one skill that I really want you to develop, that when you're delegating a patient, always remember, do not delegate an unstable patient. And who are those again? Remember the time frame. If it is a newly admitted patient, if it is a patient who recently had surgery, if it's a patient who suddenly had a change in condition, those are patients that you cannot delegate. Okay, those patients with unstable vital signs. For a new graduate nurse, what you can delegate here will be number one. Okay, that's the correct answer. The one scheduled for a colonoscopy in the afternoon. In number one, you don't have any clinical description that tells you that this patient is unstable. There's no clinical description there. Okay, but for number two, the fact that your clinical description is severe malnutrition, right? And then number three, you have the clinical description there is recently underwent a cardiac catheterization. So recently means that it is a patient that may be unstable because it's a recent. And you know that cardiac catheterization is an invasive procedure. And of course, number four, a client with Crohn's disease with fever and diarrhea, that's also an unstable patient. So for a graduate nurse, you have to assign someone who is stable. Okay, so I hope that in our session today, you're learning a little bit. Okay, learning a little bit. So before we end for tonight, I would just like to provide you some updates about our programs. Okay, so our programs, if you don't know, we recently launched the 10-week Fast Track Live NCLEX Review webinar. It's happening every Tuesday, 7 o'clock to 10:30 p.m. And this is an ongoing enrollment, meaning that you can enroll anytime. However, we have like ten modules. So you can start with any module and then you can just attend the module and then until you finish all the 10 modules. They are in sequence. It's really highly preferable if you attend module one, but if you can't wait and you really want to enroll, then you can enroll, but you just have to finish all the modules. Okay. Now, also another one, we have a scheduled 8-day live comprehensive NCLEX review webinars. So most of our classes now are in webinars because of the COVID outbreak. So we kind of like suspended our live classes for now. And if there's any change in June or July, hopefully, then maybe we can meet again in the classroom. But for now, our schedules are going to be only webinars. But again, these are interactive webinars because you'll be having a workbook, and while you're listening to me, you'll be writing down notes. Okay, so check our website at www.matusnursingreviewacademy.com if you want to know more information. And then lastly, before I leave everyone, I would just like you to also um, be familiar with my book that I published last year. It's the Simple, Fast, and Easy NCLEX Review book. This is the book version of our workbook. So if you don't have our workbook, then you can have this as well. It has the same contents, and you can buy a copy in Amazon, of course. And a lot of our students really like the book because it's very simple and direct to the point. And this is a book we're in that you can just put it down because it's very direct to the point and simple. And you look at the reviews in Amazon, a lot of students really like the book, and that's what we need. When you're reviewing for NCLEX, you want something that is simple, fast, and easy NCLEX review. Um, I would like to find out if some of you have questions right now. Let me know. Is there anything that you want to put in the comment section right now in the next few seconds so that I can answer them? So remember again that there's a change in the NCLEX administration starting March 25, and it's now April 2. you only have you only have 60 items, which is the minimum, and the maximum is 130 items. So look at that. Okay. If you do have any questions, let me know, and I will be very much happy to give you the answers. Okay. So someone mentioned it's Mars. Okay, it's Mars. Love your books, Hermatus. Thank you. Okay, thank you very much. And if you really want to have a copy of my book with my signed signature, just reach out to me. I can sign the book for you. And I wish you good luck in your NCLEX review. And hopefully that you'll be professional nurses. And these little things that I'm doing to help you out will really help you pass the NCLEX. Okay. So thank you very much, everyone, and I hope you enjoy your night. Stay home and stay safe. And I wish you good luck. And of course, study very well for your NCLEX. Thank you very much, everybody.